Welcome to Facts, your go-to channel for valuable insights into motherhood and breastfeeding. In this episode, we'll delve into the crucial topic of pumping colostrum. As the first milk produced by the mammary glands during pregnancy and immediately after childbirth, colostrum is a powerhouse of essential nutrients and antibodies vital for your newborn's health and development. Learning how to effectively pump colostrum can be immensely beneficial, especially for mothers facing challenges with breastfeeding or needing to supplement their baby's feeds. Let's explore some expert tips to help you master this process with confidence. Understand the importance of colostrum. Colostrum, often referred to as liquid gold, is nature's perfect first food for newborns. It's rich in proteins, vitamins, minerals, and antibodies that provide immunity and protect your baby against infections. Recognizing its significance can motivate you to pump effectively, ensuring your baby receives all the nutritional benefits even if direct breastfeeding isn't immediately possible. Begin early. Start pumping colostrum as soon as possible after birth, ideally within the first hour or two. Your breasts are most responsive during this time, and frequent stimulation helps establish milk production. Even if your baby is latching well, expressing colostrum can aid in milk flow and relieve engorgement, promoting comfort for both you and your baby. Hand expression technique. Hand expression is a gentle and efficient way to collect colostrum, especially when your milk supply is still low. Wash your hands thoroughly, then massage your breasts to stimulate milk flow. Use your thumb and fingers to compress the breast tissue rhythmically, expressing drops of colostrum into a clean container. This technique allows you to control the pressure and adapt to your comfort level, making it particularly suitable for sensitive or engorged breasts. Utilize a breast pump. Invest in a high-quality breast pump designed for colostrum expression. Electric pumps with adjustable suction levels and soft silicone breast shields offer comfort and efficiency. Begin with a low suction setting to mimic your baby's initial suckling pattern, gradually increasing the intensity as your milk supply increases. Pumping sessions should ideally last 10 to 15 minutes per breast, with breaks in between to prevent discomfort and maintain optimal milk flow. Store and handle colostrum safely. After pumping, transfer the colostrum into sterile containers with tight-fitting lids. Label each container with the date and time of expression for proper tracking. Colostrum can be stored in the refrigerator for up to 48 hours or in the freezer for several months. Thaw frozen colostrum in the refrigerator overnight or under warm running water, avoiding microwave heating to preserve its nutritional integrity. Seek support and guidance. Don't hesitate to seek assistance from lactation consultants, healthcare providers, or breastfeeding support groups if you encounter challenges or have questions about pumping colostrum. They can offer personalized advice, troubleshooting tips, and emotional support to help you navigate this journey with confidence and success. Conclusion. Pumping colostrum is a valuable skill that empowers mothers to provide optimal nutrition and immune support to their newborns, especially in situations where direct breastfeeding is challenging. By understanding the importance of colostrum, practicing effective pumping techniques, and seeking support when needed, you can embark on a fulfilling breastfeeding journey that nurtures both you and your baby. Stay tuned to Facts for more insightful content on motherhood and breastfeeding. Remember, every drop of colostrum you pump is a precious gift for your little one's health and well-being.